I want to get to sort of the news of the week on reproductive rights. It's been top of mind, of course, following the news that the U.S. Supreme Court has drafted an opinion that would overturn Roe versus Wade. There's been a renewed push in Rhode Island to cover abortions as part of both the state Medicaid program and in health insurance coverage for state employees. Secretary Gorbea, do you support this legislation?
Look, rights that can't be accessed are not rights. And I absolutely support and have testified on multiple occasions in support of allowing the use of Medicaid dollars as well as state employee insurance plans to cover abortion, because abortion is health care. It's up to that woman, that person, to be able to choose, what is the medical care that she might need. And so, absolutely.
Governor McKee.
Yes, I support that, as well as making sure that a woman's right to choose is protected. So I've already, we're on the record doing that. Letters are going in. And I think under the current circumstances, look, I don't think anybody would ever thought that, what Trump and McConnell did in terms of stacking the Supreme Court would lead us to this point in time.
And Governor, do you plan to?
So I would say that, we got to really take a close look at responding to that as a state. I do support the cost of the cost of an abortion, with the state and the state budget. And when that gets passed, I've already told the people who sponsor it that I'll sign the legislation.
I'm having a little bit of trouble hearing you, Governor. I think we have an audio issue, but do you plan on submitting a budget amendment that would provide this coverage to the proposal you already submitted?
Yeah, well, we would, under the current circumstances, what happened in the last week, I think that the antennas are up, and we'll take a look at that. But I think that we're encouraging the General Assembly to pass the legislation, and then I would sign it.
Ms. Kalis, should the state cover abortions?
I am pro-life, and I want to also say that the right to an abortion is codified in state law. Nothing changes based on this in Rhode Island and for Rhode Islanders. The decision was personal for me. I was preeclamptic in all 3 of my pregnancies, and my oldest son, Leo, was born at 37 weeks and was 4 pounds and something. And he was my baby, and he was always my baby. I also struggled with IVF. So life is a personal issue, but that doesn't change where the state is or the rights that people have according to the law. I do not support extensions any further of the law, but I can also count votes.
Dr. Munoz, state-funded abortion care.
Women will always have autonomy over their health. Reproductive health is a human right just as much as health as a whole is a human right. No one should ever threaten that. We've had a history in this country, even in the 60s, of taking control over women's bodies. Sterilization programs, no one spoke. Indifference for years. We will not ever allow that to happen, and anyone that is against providing comprehensive coverage, including for reproductive health, for abortion, is actually propelling us into the same narrative, the same dystopian future. So I support legislation that provides coverage. Thank you.
Ms. Folks.
Absolutely. I am firmly in support of the proposal and want to make sure that 1/3 of the people in this state get their health care through Medicaid. And I don't think that your insurance should allow us to decide whether you get access to an abortion or not.
Thank you. Mr. Brown.
Yes, I do. We were talking, my wife and I were talking with our 2 kids at dinner last night, and I was saying, when we grew up, I don't think many of us ever thought we'd see this day, where the right to an abortion was taken away. It is a crisis. It's a personal crisis happening for people across this country right now, this news, and it is a crisis for basic reproductive rights going forward. The question is, what do we do about it? And there are 2 things we can do in this state. One is to right away pass the EACA. And I've got to say, Governor McKee, I do not understand what there is to look at. This bill was submitted last year. We know what it does. It's very simple. It makes the right to an abortion real in this state. It's not a real right if people cannot afford it and get access to it. So if I were governor, it would be in my budget, and I'd be pushing as hard as possible to make it happen. The second thing we need to deal with here is the politics in Rhode Island. I mean, this issue, like many things, are tied to politics. And we did pass in this state the reproductive, the RPA, a couple of years ago. But we need to understand how fragile that is. That was a long, long fight led by activists and organizers, the Women's Project and many others. It was passed over the objection of Democratic leadership who opposed it. Many Democrats who have a pro-choice platform, a pro-Roe v. Wade platform, who opposed codifying Roe v. Wade are still in office. They need to go. I will say right now, I will not endorse and will not accept any endorsement from any elected official who is opposed to codifying Roe v. Wade and who opposed it in that vote a couple of years ago. And I would expect and hope that my fellow candidates on the stage would make the same commitment.
Thank you, Mr. Brown. I'm looking for a fairly quick response to this one. Several lawmakers have proposed creating a new tax bracket for the highest earners in Rhode Island. One bill would charge 8.99% tax rate for income above $500,000. Governor McKee, would you support taxing the wealthiest Rhode Islanders more?
I presented two budgets to the General Assembly, and neither one had any broad-based tax increases. This is not the way to go. What we need to do is we need to raise people's incomes, and that's what the focus that I have in the budget. I would go to ri2030.com. This is not the time to be raising taxes as we're coming out of the pandemic stronger than any state in the Northeast right now. I want the audience to know that. And when was the last time that the state of Rhode Island wasn't the first in and last out of these economic downturns? It took us 7 years to get through the real estate problem in 2008. Today, we're leading the Northeast, and we've been in the top 10 on average in the country. So this is the time to double down on the economy. This is the time to invest our dollars to create good-paying jobs, not tax your way into a situation where you just continually increase the cost of living in the state of Rhode Island. We have this opportunity right now to reset the state of Rhode Island. In order to do that, we need to talk about reducing the need without causing pain on those who have need. We have 350,000 people on Medicaid right now in the state of Rhode Island.
Thank you, Governor.
Those numbers do not work. So taxing at this point in time does not make sense when we're leading the country, the Northeast, in terms of an economic recovery. Let's take full advantage of that and reset the state of Rhode Island in a way that we all can afford to live here.
Thank you, Governor. Ms. Kalis, would you raise taxes on the wealthiest Rhode Islanders?
I think that we need to look at it more, but generally I am not for things that make us less competitive regionally. And this would increase the tax rate for Rhode Islanders, and I just don't think that it is a great idea.
Thank you. Dr. Munoz.
If we want to do something to help people, let's have some exemptions for tangible property tax for micro businesses. Let's have a progressive tax that, yes, taxes the top 1%, because 95% of people that don't fall in the gray area are living paycheck to paycheck. When it comes to that, progressive tax structure, I think it's important to recognize that in 2018, Governor Raimundo signed into legislation a pass-through company tax law that allows the wealthiest to get credits against the companies that they're setting up to provide them with some additional income. So there are already loopholes in place for people to benefit. We need to close those loopholes, and taxing more to the top 1% is one way. Thank you.
Ms. Folks.
No, I would not be in favor. Right now, we have a very big surplus in this state. I don't think we should be raising taxes, and we do want to be competitive with the other states. I will say that on a national level, I am very open to and would fully support making sure that billionaires get taxed more, that making sure that corporations are paying their fair share. So we do have good services like childcare and prescription drug prices. But in the state of Rhode Island, we need to be competitive. We have a surplus at this moment, and I would not be raising taxes.
Mr. Brown.
I can't understand the line of reasoning by which politicians, people running for office, lament that we have a struggling economy and we need to do something about it, and then what they advocate for is exactly what we've been doing for 40 years. We've tried the massive tax cuts to the rich economic approach. I mentioned earlier, we gave a tax cut to the wealthiest 1%, so that's people making over $450,000 a year. The people running things gave that tax cut. It cost the state $1 billion. And so I know there are some people here, I'm sure, who are in that category, but do you really think that was good economics? Did that really work out well? And for people who take the perspective, if you're, the way you think about it is what's the perspective from a business standpoint, how does a business, particularly a small business, survive when the people in the state have no money to spend? Because we've given it away to the wealthiest 1%. We've given it away to corporations. And people's wages have stayed flat, and their housing and health care costs have gone up. That, to me, is really bad economics. It's not going to work. We need to build our economy not from the 1% down, but from workers up. We need to bring down the cost of housing, bring down the cost of health care, raise people's wages, guarantee a minimum wage increase of $19 an hour so people actually have money to spend. And some of those people will then start small businesses. That's how we build the economy. We've tried it the other way, to be clear. And I would hope we could all agree by now that the trickle-down approach is a failure. It doesn't work.
Thank you. Secretary Gorbea.
Yeah, look, if you're doing better off in life, you should pay more than if you're not. That's sort of a simple way of looking at these things. The truth of the matter is that before we got all the federal monies, we had structural deficits going on in this state. Now, some of that is better. We need to do a better accounting of how we're using our state dollars. But we have been cutting taxes to the point where possibly we honestly can't afford what we need to do going forward. And so I would support taxing at higher levels of our incomes here in the state, both individuals and corporations. But I would do it in a way where we actually target those monies and you know where it's going, because I think that's the real disconnect. If any of you come with me and walk in the shoes of people who honestly can't afford to live in this state, you would agree, and I know because I know the people in this room, you're good people, you would agree to help those people out because you see them struggling. And one of the ways that we do that in government is by taxing. It's as simple as that.
Thank you. I want to get to a rapid-fire section. This is my favorite part. What I'm looking for from each of you is a one- or two-word answer so we can get through a bunch of questions and see where you all stand. And we're going to go right down the line. So starting with Mr. Brown, right now Rhode Island offers free tuition through the Rhode Island Promise Scholarship at the Community College of Rhode Island. Should that program be expanded, free tuition to Rhode Islanders at all three of our public colleges and universities, yes or no?
Yes.
Ms. Phillips.
I would expand that for nurses and teachers is how I would expand that program across all of the universities.
Yes. Should the Promise program be expanded to all three of the colleges?
Yes, I'm willing to look at that, but I actually want to propose something a little bit different, which is...
Quickly.
Okay, not everybody can go to college right after high school. Why not save a Promise credit to be able to be used later on in life when you've gone out into the work world and suddenly you need to upgrade your skill sets? And so I think that to me is more appealing than necessarily right now expanding it across the board.
Ms. Kayla, should we have free tuition at all three of Rhode Island's public colleges?
I would want to look at it more, and I want to echo the need to also have options in trades and technical training as well.
Governor McKee.
So I signed the College Promise, extending it for CCRI, and I think that's a really good thing to do. You'd have to take a look at the numbers to see what it actually would cost before you actually said yes or no to that. But one of the things we will be doing is rebranding Rhode Island College, and I can see at that school a way to fund the junior and senior year.
Dr. Munoz, free tuition.
Based on vision and values, we should expand it and simultaneously ensure that those that are part-time, non-traditional students can access the program while bringing all Rhode Island jobs program within Rhode Island Promise.
I want to stay on you, Dr. Munoz, still on rapid fire. Who should be the next mayor of Providence?
I'm going to let him fight it out, and we'll figure out who wins in the end.
Okay, Governor McKee?
Yeah, I think that's a good answer.
Ms. Kalis?
I'm sitting this one out, too.
Secretary Gorbea?
I live in North Kingstown, but yes, one of the candidates worked with me, and I have a deep regard for him.
Wow, we're all aligned so far. I'm with the group.
I would hope somebody on this stage would be mayor of Providence. Anybody? Anybody? No, I don't.
Well, apparently the endorsements are all, they're all up for grabs, apparently. Mr. Brown, I'm looking for a dollar amount. What should the minimum wage be in Rhode Island?
$19 an hour, which is just about $40,000 a year.
Ms. Folks?
Today it's $12.25. I would accelerate the move to $15.
Secretary?
I think we're on the path right now to get to 15, and we need to get there.
Ms. Kalis?
Yeah, I agree that we are on a path and we shouldn't deviate from the path.
$15 an hour is a good start, but that's not enough money for people to actually earn a living. Well, that's why we're going to invest $40 million in job training, and we're going to invest dollars and I hope they get a chance to talk about the education program that's in play, that we're putting in play. But yes, $15 an hour is a minimum wage, but you can't raise a family on $15 an hour. We all got to understand that, right? So we've got to have ways to increase income, and that's one of my top priorities in the state of Rhode Island, is to increase income so families can afford to live here. That is a fundamental way, by the way, to address some of the housing issues that we have.
Thank you. Dr. Munoz?
Yeah, minimum wage is a poverty trap. However accelerated it is, if it's not getting to 25, people still cannot afford to live. So we need to supplement wages with a supplemental wage program to get to a livable wage.
What's the number?
Yeah, so the number, our goal should be $25, however long it takes, met with a supplemental wage program to ensure that single mothers in this state, single parents, can afford to live here and raise their children.
Okay, staying on you, Dr. Munoz, when it comes to the Law Enforcement Officers' Bill of Rights, would you repeal, reform, or keep it the same?
Repeal. We have a state accreditation process that
Going rapid.
assesses.
Sorry? Repeal. We're going rapid, so repeal next up,
Repeal,
Governor McKee.
okay.
What's the question?
When it comes to the Law Enforcement Officers' Bill of Rights, would you repeal it, reform it, or keep it the same?
That's the police?
Yes, the Policeman's Bill of
reform.
Rights. Is
I'm in favor of the reform that's currently in place.
Thank you. Ms. Kalis?
I would want to look at it a bit more.
Okay, Ms. Secretary Gorbea?
Reform.
Reform?
Reform.
Ms. Folks? Mr. Brown?
Repeal. We have a constitution that applies to all of us equally.
Mr. Brown, if one of the other candidates on this stage wins the Democratic primary, do you pledge to endorse them in the general election?
Yes.
Ms. Folks?
Yes.
Yes.
Secretary? I'm going to let you out of this one.
Yeah.
If you get a primary another candidate, I will ask you that question. Governor McKee?
I support Democrat candidates.
What's the question? I'm sorry.
If another one of the Democratic candidates on this stage wins the primary, will you endorse them in the general election?
As long as they're consistent with the values that we all represent on this stage by the time we get there.
Okay, that sounds like a maybe. Dr. Munoz, what current or former elected official do you most admire?
Bobby Kennedy, the last 90 days of his life. Governor
McKee?
Barack Obama.
I'm going to lean into Governor DeSantis.
Secretary Gorbea?
That's a tough one, actually. I actually really enjoyed reading about a former governor of Maine, Joseph Chamberlain. If anybody's seen The Fallen Angels, he was a governor who walked with his troops, and I really loved that part about him.
Ms. Folks?
FDR.
Okay, Mr. Brown?
John Lewis.
Okay, our last rapid-fire questions, my favorite. Mr. Brown, what is your favorite Rhode Island state beach?
State beach. Tappan's Beach.
Okay, Ms. Folks?
Town Beach. I'm a Narragansett Town Beach kind of girl.
It's a town beach, but we'll let you have it.
So I'm really fortunate that I live in North Kingstown, which has many, many beaches, and I don't go to the state beaches. I actually walk to the beach through one of the coastal access points, which is why I firmly believe that people should have access to the shoreline.
Second Beach in Middletown after 2 p.m. after camp when it's empty and my kids can go boogie boarding and get attacked by seagulls. So.
Thanks. Governor McKee.
Yeah, Newport's great.
Dr. Munoz.
Take Ives Road past Goddard Park in Potawatomi, and there's this little community beach right at the end.
I'll have to check it out. We're now going to get to some of the questions that our audience members submitted while they were having lunch. Thank you so much. We'll probably only get to one of these. And we're going to start with Governor McKee. What are your thoughts on lowering income taxes given the current budget surpluses?
I think right now, I think that you should be looking at other areas. If you have the flexibility, sales tax is something I think you should be looking at lowering. The income tax, my thinking is that right now our competition is our bordering states, Connecticut and Massachusetts. And we should be leveling the playing field between those states, two states, as our first option. Right now, we're competitive on our income tax with both those states. So my feeling is you should go look at areas like we have in our small business friendly budget item, which is talking about motorcycle trade-in values not being offsetted on sales tax in Rhode Island, but they are in Massachusetts and Connecticut. So we're putting that in the budget. So I think you have to kind of find these areas where you can level the playing field competitively in the tax structure between Massachusetts and Connecticut. And then that's the starter, and then you move from there.
You mentioned the sales tax. Should we look for a proposal from you soon, Governor, to lower the sales tax?
I think we should be looking at being competitive with both Massachusetts and Connecticut. They're about 3/4% lower on the sales tax right now, and I think that's something that we should be looking at.
Dr. Munoz, on the income tax.
Yeah, I think we should talk about extending child income tax credit. I think we need to focus on credits to support working families in the state, to be very targeted in our approach.
Mr. Brown, do you think we should lower the personal income tax?
No.
Ms. Folks.
I proposed, as I said before, a $500 tax credit in a one-time to help people through the period we have, and beyond that, I wouldn't be proposing to lower any other taxes at this moment.
Secretary Gorbea.
Yeah, no, before this pandemic, again, we had a structural deficit going year after year after year. The pandemic monies are not necessarily something that we should be using to do long-term cuts until we get our house in order. And I look forward to making sure that we do that.
Ms. Kalis.
We need to look at all taxes. We were ranked 40th by the Tax Foundation in terms of the state tax climate. I think we need to look at all taxes and figure out a better way to tax that makes us more competitive or not.
Well, thank you all so much. We didn't get through all of the questions I wanted to ask in the short hour we had together, but you are each going to get a 1-minute closing statement, and our timer is Lauren right there. So this is the one part of the event that is actually timed. And so your 1-minute closing statement, Ms. Folks.
Okay, great. Well, it's terrific to spend time. I'm going to introduce myself because many of you don't know me, but I was born and raised in Providence, the oldest of 5 kids, and I came back here after school to work in Woonsocket at CBS, and I spent 25 years there. Over that time, I had 4 kids very quickly and got cancer. One of the reasons I'm running is I realize people are one hazard and terrible episode away from really struggling. I'm very proud of the decision I got to lead to get rid of cigarettes in all of our stores, and I think it shows the kind of leadership that I bring. You can hear today I'm focused on education, affordability, and we didn't talk enough about driving a great economy. It's very important to me. But I think at the end of the day, I'm not a politician. I've never been one, but I know how to get things done. And that's absolutely what I would love to do for the state of Rhode Island.
Mr. Brown.
So I've outlined some of the things I think we need to do. I don't think they're a mystery. We need to raise people's wages. We need to build 10,000 affordable homes so we can break the backs of the affordable housing crisis. We need to restore the Medicaid funds that were cut and move toward a Medicare for all style system that takes profit making out of providing health care. We need to tackle the climate crisis. We need to shut down the polluting fossil fuel industries in the Port of Providence that are choking the children there, mostly black and brown neighborhoods. So we know what we need to do, but nobody can do that alone, which is why I'm not running for governor alone. I'm running along Senator Cynthia Mendes in partnership who's running for lieutenant governor, and not just that, we're running alongside a whole slate of candidates. These are nurses, teachers, social workers in the Rhode Island Political Cooperative. These are the people who've been doing the work of caring for and fighting for our communities for a long, long time. And so this is a campaign not just to win the governor's seat, but to win a whole new government so we can get these done for the people of our state. Thank you.
Secretary Gorbea, your closing statement.
Yeah, hi, I'm Nellie Gorbea, your Secretary of State. You've come to know me because I've also worked with you in so many other issues like housing, education, all sorts of issues. What you get with me is someone who knows how to make government work well. A lot of you over the years have told me how you were able to vote well, safely, securely, how you were able to start businesses, that you love the way my office works, that the lobbying system is clear and concise and transparent. Those are the things that we need in our government. I have the leadership skills, and you've seen me work on these very hard issues and deliver results. So when I say that I'm going to grow our economy, that I'm going to do it by making housing affordable, making sure that education in our state is a quality service, and that we solve climate change issues, you can count on it, because you've seen me do it before in other places. Thank you.
Governor McKee, your closing statement.
Yes, first I'd like to thank RIPAC for putting on this forum and saving my chair as I was deciding how I would get here, so thank you so much for that. But let's go back to when I was first sworn in as office, where we were as a state. We had some of the highest death rates in the country. We had some of the lowest vaccination rates in the country. Harvard had just given us an F. It's tough to get an F from Harvard. Since then, we have the best vaccinated state in the country because of our municipal leaders, because we activated our firefighters, because we activated our rescue and our school nurses. And because of that, we reopened our economy faster than anywhere in the Northeast. We have momentum. Let's take advantage of that momentum. And I'd like to just share with you what Dr. Jha said when he was asked at a child mental health forum. When are we going back to 2019? The question was asked. We're not going back to 2019. We have an opportunity in this state to come to a different spot, a better spot, and let's take advantage of the momentum that we have been able to cover over the last 14 months. Thank you so much for having me here today.
Thank you, Governor. Ms. Kalis.
Rhode Island needs a fighter, now more than ever. COVID brought front and center the haves and the have-nots, and every day it's getting harder for working families. As a mom of 3 school-age boys, I understand the struggle. And for me, I am a problem solver. I saw firsthand through delivering vaccines and tests how government does not serve the people. And I'm all about holding people accountable and getting things done. I believe in benchmarks, standards, key performance indicators, and the law. And that is what I will do as governor. I will hold people accountable, and I will deliver results.
Thank you. Dr. Munoz, your closing statement.
Yeah, thank you so much for the opportunity. You know, John Gardner once said the primary role of a leader is to keep hope alive. Growing up in Central Falls in an urban core city here in Rhode Island that was 17% in terms of positivity rates for COVID-19, what I learned is that the way you keep hope alive is by fighting. And I have proven that I am willing to fight administrations that will not stay in alignment with the moral principles that we talk about here today. We saw inequities widen during COVID-19, but they were present. Who was speaking about them then? What will we do today for the next 7 generations? What will we do today for the next 10 years? If we do not allocate ARPA dollars effectively to not just create programmatic changes around education, but to ensure that we are working with municipalities to solve the housing crisis, then from my perspective, the person who experienced homelessness, who had a father who struggled with addiction, who saw a single mother struggle, knows that nothing will change. And that's why I'm running. That's why I'm fighting. And I will never stop fighting. Thank you.
Round of applause, please, for our candidates. Thank you.